Is heart disease a man's disease? Do women not really suffer? Or do we have very little information and research around the heart health of women? Heart disease is something that even women are susceptible to, particularly those women who have diabetes, PCOS, or many such complications that make things even more difficult for them. Heart disease is indeed a woman's disease as well. Take a look at this report.
The rate of heart disease in women is rising, and there is every reason why women's heart health must be prioritized. Studies show women suffer worse outcomes than men. Yet treatment for women is regularly delayed and the conditions are often misdiagnosed. What is worse is that the guidelines to treat heart disease come from studies done in the 1990s almost exclusively in men. Even today, only about 30% of study subjects are women. Heart disease in women is just not the same as heart disease in men. There is just something different about a woman's heart versus a man's heart. There are specific risk factors too. Women are more prone to get any heart-related problems due to factors. Any fluctuation in hormonal levels of a woman can lead to a higher risk of heart disease.
Women until their childbearing age, which is about the time they reach menopause, women's hormones, especially estrogen, has known to have protective effects on developing cardiac problems. Especially when it comes to developing plaques or atherosclerotic disease. Estrogen has a protective effect. After a certain stage, after 40 or around the time when women reach menopause between 40 and 50, the risk starts increasing after that.
It may impact one during pregnancy, period 2, like gestational diabetes and preeclampsia can be warning signs for future heart problems.
A woman becomes more prone to cardiac diseases once she is menopausal because of the protective effect of estrogen wearing off. Secondly, there are certain things which many women have to subject themselves to, like contraception. Now you have various types of contraception. You can have mechanical or you can have the contraceptive pills. So if you are on the contraceptive pills, then there is if the woman is smoking as well, then there is a higher incidence of blood clotting disorders or getting clots in the system. So this can affect the woman because she is on certain medications.
There are many conditions which are restricted to pregnancy and hence they are restricted to women as far as heart disease is concerned. So the commonest one is called pregnancy-induced hypertension, which is that the blood pressure rises during pregnancy, and this in a certain fraction of women then go on to have very disastrous consequences called preeclampsia and eclampsia. A very uncommon but very serious complication which happens in certain women is that during their last phases of pregnancy or immediately after the delivery, their heart muscle suddenly becomes very weak, and this is called postpartum cardiomyopathy. And again, this is a very, very serious condition, often very underdiagnosed in the Indian context.
Depression and chronic stress, which are more prevalent in women, can contribute to heart disease by affecting lifestyle choices such as diet and exercise and increasing inflammation.
This stress can be extreme physical stress. Sometimes you would see people collapsing in gym, and that's because people who are not used to extreme physical stress, if they put undue stress on their body all of a sudden, this can happen. Or if somebody has intense mental stress, that can also precipitate this kind of a heart blockage. And this mental stress, there are several factors to it, but feeling a lot of depression and feeling of unexpressed hostility, which is very common in Indian urban areas now, because people feel very frustrated with so many things. So that unexpressed hostility again has been linked to this development of heart attacks.
Recognizing the cause is crucial to the heart health, especially when the least known fact is heart cases in women are largely unreported.
The incidence of cardiac ailments is similar in both men and women. It may be because just of the socio-economic structure of a society that men seek medical advice first and women don't come to the hospitals. Many times in villages, the men often endure their ailments and they do not report to the doctors or they do not seek advice. So it's very difficult to tell what is the incidence in the rural areas, but yes, in the urban areas, this is what it is. Obviously, things like palpitation and things where you're getting swelling on the feet, you should immediately come to the doctor and seek advice and see whether you are suffering from any cardiac ailment. Where there is a family history of cardiac disease, these people should definitely visit their physician or a cardiologist at least once a year, especially when they are in the age group or rather when they are more than 45 years, and get a baseline check done and then get it done every yearly, because this is something which is easily avoidable. You can avoid a sudden death.
In general, heart disease treatment in women and in men is similar, but being gender specific makes the treatment work faster and better. Such as women are less likely to be treated with aspirin and statins to prevent future heart attacks than men. Women are less likely to have coronary bypass surgery because they have less obstructive disease or smaller arteries with smaller vessel disease.
Regular checkups, open conversation with healthcare providers, and a proactive approach towards heart health can help women live a longer and healthier life. And heart health of all can simply be managed with a better lifestyle. This is Simranjeet Kaur with camera person Sachin Chandok for India Today.